As Stephanie mentioned, I'll be discussing some interesting findings coming out of the UCNets LGBT Oversample, which I'll introduce in a second, especially following a major health event. So in general, network responses to major health events frequently lead to increased contact with certain kinds of network members, especially family members. We see increases in retention, maybe some gains in family members, at least initially, following a major health event. They also may provide new connections, especially to support personnel or others who are involved in the respondent's care. We have some kind of countervailing processes also going on, though, that may limit engagement with some existing ties, especially friends at work, friends who are more distant, for example, who are less likely to be able to kind of help the person who had the major health event. So what's different for older LGBT adults? Well, to begin with, even before these events happen, they have differently structured networks. So some of the work that I've done coming out of these data find that older LGBT adults already have fewer spouses, and including partners in the home. So that's not just a marriage, legal marriage effect, but also partners in the home. Fewer kin in their networks. This may be a result of leaving families who are not supportive or family rejection processes happening over time. They're also less likely to have children, including adult children, because fertility and adoption have been constrained among older LGBT adults for legal reasons, for financial reasons, and so on. And so in general, we see fewer kin in these networks. As a result, we tend to see more reliance on friends in the absence of a major health event. So in general, we see people relying more on friends, especially LGBT identified friends. Following a major health event, we would also expect to see that some of these lack of access to supports would lead to lack of access to social support when you do have a health event. And potentially fewer new connections following health events. This could be variable at the individual level, especially based on whether or not one of the older LGBT adults has a prior history of experiencing discrimination in healthcare settings, for example, and may be less willing to reach out to other support members who they think or support alters who might be more discriminatory. So these kind of patterns and histories of discrimination and experiences of harassment and so on, judgment, might lead an individual to be more closed off after a major health event in terms of additions. To think a little bit more about what friends are doing in this context, which is one of my aims here, we know that friends provide a lot of the support in the absence of kin when people need need social assistance and social supports. 3/4 of older LGBT adults from other surveys report caring for others, including their parents, partners, and friends in the community. But it's unclear how reliance on friendships is going to affect access to, the reliability of, and durability of different kinds of support. And that might be economic support, actual physical or instrumental support, and emotional support when something happens. So I'm going to focus today on some of those durability questions. Do friends stick around when you have a major health event in an older LGBT person's network? There's some evidence that these relationships, friendships, may be less robust in particularly difficult circumstances. So following a major health event, these relationships may be more likely to be lost relative to other populations. So in the event, in this kind of setup, I'm thinking about whether friends can really substitute for kin in the ways that we expect them to for older LGBT adults. So some of the questions, just to give you some of my motivation here, are thinking about how older LGBT adults networks respond to major health events in the short term, so in the wave immediately following a major health event, and in the longer term, so thinking with a leap to T+1, what's going on a year out, right? What alter characteristics predict loss or gain following a major health event? In particular, how durable are ties to kin? Are they stepping up essentially? Are they dropping out? As well as how durable are relationships to other LGBT identified people who may provide key supports for this population? Some of the key findings as an overview I want to express up front just so I can guide you through the presentation. But in general, older LGBT adults in the UCNets Oversample have comparable turnover in networks relative to the UCNets random sample. So Fisher and Offer's 2019 paper looking at the wave 1 to wave 2 retention estimates that about 53–54% of ties persist from wave 1 to wave 2 in the random sample of adults in the San Francisco area. And in the oversample, which is just focused on LGBT adults, we find that about half of those ties persist across all 3 waves. And another 25% persist for exactly 2 waves. Between 1/3 and 40% actually experience a major health event in any given wave. And respondents tend to lose fewer ties in the wave immediately following a major health event. So they retain more ties following a major health event. LGBT identified alters are a substantial part of older LGBT people's networks. The average is about 40%. So if we're thinking about who's in people's networks, this group definitely matters and is a non-trivial part of people's networks and should be measured. LGBT identified alters are also especially resistant to being dropped. So relative to other characteristics, they are the most likely to not be dropped with or without a health event. Kin are more likely to be retained immediately following a health event. So we do see some decreases in the likelihood that they'll be dropped following a health event, but this effect actually subsides by T+1. So they kind of returns to normal, to 0 when you're evaluating the following wave after the health event. Respondent characteristics also kind of shape gain and loss trajectories. I don't think this is likely to be news to someone, but does kind of impact the way we think about who might be needing more help and not getting it at the margins. So to tell you a little bit about data and methods, we use the UCNets LGBT Oversample, waves 1 through 3, which were collected between April 2016 and January 2019 with about 15 months in between each observation. And this oversample extends the UCNets main sample, which is a random address-based sample, looking at older adults in particular. The UCNets Oversample does not include younger adults, but we do use the same instrument. So these data are comparable and can be linked to the main sample. As a result of the UCNets main sample sampling strategy, there's also quite a few LGBT people in the random address-based sample in the older sample as well to compare to. Our main outcome here is alter loss, and we identify alters as lost if in their first missing observation after their initial appearance. So they're only lost once if they don't reappear. Someone who's present in wave 1 and wave 3 is not necessarily counted as lost in wave 2 since they reappear. We keep someone as lost at missing until their first appearance, so someone who's new in wave 2 is not counted as lost or not lost, and then they're 0 if they're present in the wave. The alter new outcome is structured very similarly. It's 1 when someone first appears after wave 1, so everyone in wave 1 is not counted as new. You can only be counted as new starting in wave 2 or wave 3. They can reappear or not. So if they are new in wave 2 and not in wave 3, lost in wave 3, they're still new in wave and 0 if present in the wave, and they're not on their first observation. Sorry, escaping. There we go. Our other variable of interest is whether or not someone has experienced a major health event, which is counted as one if they have had a new diagnosis, new disability, hospitalization, or another serious health issue in the last year. So we estimate 2 different models. The first model that I'll talk through is looking specifically at the individual level and some kind of aggregate network characteristics. So predicting total alter loss, so the total number of people you've lost in a wave, the total number of people you've gained in a wave, given some of the time varying and fixed ego characteristics that we have, with a particular focus on how health and major health events structure loss for the ego respondent. Then we estimate a 3-level model at the alter level, predicting alter loss, so the probability that you're lost or gained, given characteristics of the alter at time 1, if we're talking about alters who are new, and at time t-1 for alters who are lost. So given that you are lost in wave 2, we will have the characteristics from wave 1 assigned to that alter. We'll also estimate some time varying and fixed ego characteristics to control for some variation. Essentially here, again, our aim is to look at how major health events are structuring loss for particular kinds of alters. So looking less at who's losing how many and more at what kinds of people are dropping or gaining. So here's the respondent level analyses of network responses to major health events. To give you a sense of what our data structure looks like here at the ego level, I mentioned we have 3 waves. We have 85% retention across these 3 waves. We have some people who drop out, very few, 5% who drop out for just wave 3, about 8% who only completed wave 1, and then a very small number of folks who did a split. We tried to re-find a few folks who we lost in wave 2 and found 3. To give you a sense of how the UCNets Oversample differs just a little bit from the UCNets main sample, including LGBT identified folks in the UCNets main sample, we do have more males in the male identified folks in the oversample. This is a convenience sample, so we're kind of bound by how we were able to do recruitment, which was online and at community organizations and community events and so on. So we picked up more male identified respondents in the oversample. Otherwise, they tend to be similar in terms of age, education, and racial demographics, but we do tend to have more married folks in the oversample, so we do see more partners than you would if you were doing this analysis with LGBT identified folks in the UCNets main sample, random sample. This also kind of gives us a suggestion that some of our estimates might be like our best case scenario if we're thinking about how marriage and partnership might structure losses, and the oversample has more marriage. Major health events, as I mentioned, between about 1 in 3 to 1 in 4 or 4 in 10 have experienced a major health event in the current wave that they are responding to. And again, this is any new diagnosis, disability, hospitalization, or serious health event in the last year. This measure does seem to, like experiencing a major health event does seem to structure loss for alters, especially at wave 3. We're looking at this. I think there are potentially some elements here that we need to continue looking at the data cleaning protocol for, but we feel pretty confident that what we have here reflects people's networks. Essentially, this is asking across waves about many different kinds of alters who provide different kinds of help, and some of the matching think is maybe still a little bit problematic here, but in order to kind of think about who might need extra scrutiny, we've taken out the top 5% of folks who have very, very high alter losses. So over 12 lost alters, essentially kind of a total network reworking in order to make sure that we're not actually just counting somebody's network twice. But overall, we see that everybody loses somebody. This is very consistent with some of the earlier presentations that over the course of the survey, everybody loses about 1 to 2 alters. At wave 2, this seems to be a little bit lower. At wave 3, we are seeing quite a lot of loss. I'll give you one indication of why that might be in a second. We think about other alters, specific kinds of alters, but as up to as much as 4 or 5 alters being lost on average in wave 3. Major network effects of major health events on network size, as well as total loss and total gain, are presented here. This is just a kind of very preliminary model to get a sense of which direction things are moving and controlling for a very limited set of respondent characteristics. There's certainly more we could control for here, but the aim was really to get a sense of which direction we should be looking and whether or not we are going to see different patterns of gain or loss across alter characteristics. But in general, we see that the probability of loss goes down after experiencing a major health event. But in general, other things like network size and whether or not you're gaining new members tends to be very similar. At the alter level, there's a little bit more happening. So I'm going to present now ultra-level analyses predicting loss or gain following major health events. To give you a sense of what those data look like across waves, we have about 54% of alters who are retained across all 3 waves. So we're able to match 54% of these folks across all 3 waves. And we have many others who come in for 2 waves, as I mentioned. So around 25% are present at wave 1 and wave 2, or wave 2 and wave 3. So we have 2 observations on about 25% of the remaining alters, and 1 observation on the rest. In terms of network characteristics at the alter level over each wave, the mean number of alters that a respondent reported in wave 1 is about 11.8. And this increased to 19 alters in wave 2. Some of this looks like people are also being prompted about someone that they forgot, as well as people adding quite a lot of new people. We've again reduced or kind of trimmed off the upper 5%. That may be some non-matching observations that are still lingering in the data. We've been over these many, many times, but still may have a couple that are not matching quite right. So think of that as kind of a preliminary number with an asterisk, but essentially I think that's actually very close to what seems to be happening. And so with that general increase, you see it kind of fall off, and that may be why we see so much loss in wave 3 in general. The percent kin that we find is running at about 1 in 5. So about 1 in 5 network members are kin. We don't include partners in this calculation like some do, just in order to be able to think about partners as separate entities in a few other pieces of our analysis. Additionally, the percent who are LGBT identified is about 40%, between 40 and 45% across waves. And again, this does not include partners. Partners are not always LGBT identified. We do include bisexual folks who may have a opposite sex partner, and who that opposite sex partner may or may not be LGBT identified. So it's not like taken for granted that the partner would be LGBT identified, but Nonetheless, we exclude them here so that we have kind of a more precise measure of everyone else that's in the network as opposed to the partner. So in addition to partners, people have about 40% of their networks who are LGBT identified. To give you a sense of loss and gains in alters by relationship type and identity, you can see that partners in particular are relatively stable. They're most likely to be present in all three waves. And other relationships kind of go down from there in terms of present in all three waves, with some increasing loss and also increasing gains. So one of the things that I wanted to kind of highlight here for you was that LGBT identified alters who are not partners and who make up about a third, like between a third and 40% of both networks, are relatively stable here, right? So they actually occur between partners and kin in terms of their likelihood to be present in all three waves. They have fairly low percentages of loss and fairly low percentages of new occurrences. So in terms of revisiting our question of LGBT alter durability, this is a kind of early signal that we may find that LGBT identified alters tend to be fairly stable relationships compared to others. So compared to friends, compared to non-kin, non-friend others, all the way at the right of your screen. Some of the, I'll start now with some of the model results. So we were estimating the probability of alter loss following a major health event. What we have here is actually 4 models estimated initially for individuals who experience no health event at time t, individuals who experience a health event at time t, individuals who experience no health event in one wave previous, so t-1, and individuals who experienced a health event at t-1. Essentially what we're looking at here is the impacts of experiencing major health event in the wave immediately following the major health event. The major health event question is asked in the last year. Have you experienced a new diagnosis, new disability, hospitalization, or other serious health event? And so this is, the wave is capturing what's happening immediately following that. With the lag added, we're actually looking at the wave after that major health event has been reported. So what do we find here when we're thinking about who is most likely to be lost following major health event? LGBT identified alters, which you see circled at the top here, are especially resistant to dropping with or without a health event. So you see them on the with a negative coefficient significantly lower in any case, and with some kind of increase in terms of the coefficient after 1 year. So they might be a little bit more likely to be dropped at t+1 following a major health event. Possible decreases here in the likelihood that kin, friends, and others are dropped immediately following a health event. What I'm having you kind of think about here is this diagonal line that's in this presentation of coefficients here, where immediately following a health event, you see a decline in the dropping of kin, which then kind of returns to about 0. I understand that these coefficients are not necessarily different from one another. I think you'll hear a lot of probable and possible and maybes, and one of the things that we'll be doing in some of the follow-ups is to think about what patterns are here and what we can triangulate in the main sample as well as in the SNAP sample with a lot more power. But essentially, we're kind of looking for trends in terms of who's more likely to be dropped and when, and what happens immediately and in a longer term after a major health event. If we're looking at the others, non-kin, non-friend others, we do see some distinct kind of patterns here where following a major health event at time t and at time t plus 1, you are less likely to drop these others, so you're more likely to retain them. All right. We also looked at whether proximity and closeness were going to predict alter loss following major health event. We see that some household members are potentially more resistant to loss following major health events, and this continues at T plus 1. We see an initial retention of alters who are farther away. So people who live over an hour's drive away have a slight drop in their likelihood of not continuing in the next wave. And we see that initial retention of alters who are emotionally close. And this effect is maintained, but to a lesser extent, at T plus 1. We also looked at how social roles would predict loss following a major health event. And generally, we see that there's more retention of alters in social roles. So you see negative coefficients on things like socialize or confide in, as well as some variation here in terms of whether or not folks are seeking advice or instrumental help. So there are some exchanges of social help for practical help happening, especially at T plus 1. So we see some increases in the likelihood that an alter will be dropped following a major health event in the longer term. In terms of how people might be responding to other burdens in their life that alters contribute to following a major health event, we see that initial drop of demanding alters immediately following a major health event. So this coefficient moves fairly negative in terms of the likelihood of drop. And then the greater retention of reciprocal helping ties at T plus 1. So people are less likely to be dropped if the relationship is a reciprocal one in terms of help. So it's someone that the respondent gives help to and also receives any of the previous kind of listed help behaviors from. Finally, we looked at some responding characteristics predicting alter loss in this model, and I think here you see divergent stories by race and education. So we have non-white respondents more likely to lose ties in either case, so major health event or not, they're more likely to lose ties across waves. And health events may exacerbate some of this loss at time T with a little bit of recovery by T plus 1. We see divergent stories here in terms of respondent education with potentially explanations that could be about differential mobilization and retention following health events. Looking at gains, we see that LGBT identified alters are unlikely to be new with or without a health event. So these coefficients are fairly consistent and very negative. Whereas we do see potentially increases in the likelihood that kins, friends, and others are gained following a major health event. These gaps are small for kin and for friends, but get larger for others. So the increases are largest for others following a major health event in terms of gains. These effects look fairly durable over time, so they're compounded. Again, being new, you are only counted as new once, so we see these kind of not only are you getting new people in the wave immediately following your health event, but also in the wave after that. Following a major health event, you're less likely to gain alters in the household. That makes sense. We're retaining household members as well as emotionally close alters immediately following a major health event. There is also some tendency towards less gain of people in social roles, so they're not adding new people in to socialize with or who they confide in. There's I think some interesting things going on here in terms of sign flipping and wider gaps tending towards higher likelihood of gain for those in helping roles. So exchanging or adding new people in the network who they seek advice from, who they can get instrumental help from, who will help if they are sick or injured. So accumulating new alters in these areas, particularly around help. And that effect started being durable again over time, so compounded in the wave immediately after. Finally, thinking about how demanding alters might be moving here. We do see some sign flipping following a major health event, suggesting an increase in alters that the respondent finds demanding, and a low likelihood of gaining any kind of reciprocal ties as following a major health event. These ties take more time to develop and require that the ego also have some help to give, which may be less forthcoming following a major health event. And just like with loss, we do see, again, divergent stories here by respondent education, essentially the flip sides here, where health events may accelerate new connections for non-white respondents, and some differences in terms of college education, educated egos being able to kind of have more network stability. So some key takeaways here. LGBT identified alters are a substantial part of older LGBT people's networks. 40% is non-trivial in terms of thinking about someone's broader network context, but we don't really measure them. We don't target this population, except for a handful of studies, including this one, as well as the new SNAP study that's ongoing and currently collecting data. So thinking about ways to incorporate this question about an alters LGBT identity into existing or new surveys, I think, is a really important one. LGBT identified alters are especially resistant to dropping with or without a health event. So in terms of thinking about this question of are LGBT identified alters going to be available following a major health event, the answer here at least is yes. What kinds of help they provide, I haven't answered for you today. But whether or not they're at least there in durable relationships, the answer is yes. There's other possible decreases in the likelihood that kin, friends, and others are dropped immediately following a health event, so those relationships are retained, but in the short term. But kin loss goes back to normal by T+1, so these relationships may just provide some short-term alleviation of any support needs. The losses for friends and others is compounded at T+1, so we actually see continued losses. Whereas we see substantial gains of others throughout following health events, and this continues again through T+1, so some trading of new network members and some losses of existing ones. Also, we see that network restructuring is happening following major health events, with alters who provide certain kinds of help, in particular instrumental and emergency help, that help that's offered when someone is sick or injured, favored in retention and favored in new additions. And some other respondent characteristics contribute to the experience of major health events and their effects on networks overall. In particular, we see divergent stories by race and by education that are important to continue thinking about. Thanks so much. I'm very happy to take any questions and talk more about these data and opportunities to use them if you're interested. Thank you.
Great. Thank you again, Tara, for your presentation this morning.